You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. Hot topic. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic. In fact, he is Orange County and LA's go-to implant dentist, Dr. Robert Wolf. Dr. Wolf, welcome to the program.
Thanks for having me.
Now, before we get into today's topic, for people that don't know your practice or your center,
right,
who's the typical patient that's coming in for dental implants?
Well, a typical patient, Randy, I'd categorize them in three different categories. One is that they would be that person that's just missing one or two teeth, and so they come in and they just don't want to lose any more teeth. They want to maintain their smile, and so they're in because they want to prevent future damage and future loss. Second patient is the denture wearer, that person that's had dentures for a while, and those are the people we can help the most.
You don't like dentures, do you?
No. Can I say I hate dentures?
Okay.
I hate dentures. Well, I don't like dentures because I know how bad everybody feels with them, and I know how miserable and how people struggle with them.
Okay. And
so I really don't like dentures. If it up to me, no one would ever wear dentures. Okay. And so the denture wearers, the problem with the denture wearers, they're out of the systems. You know, they've had their teeth removed. They wear the dentures. And a lot of them had dentures because they just didn't want to deal with it. They just didn't want to have anything to do with it.
So it's hard to get them in.
Hard to get them back in the office once they've had dentures because they don't really need to come back in that much.
All right.
And then the third person is that person in the middle. Those people that they've been seeing a periodontist for years maybe, or they've had a lot of gum disease, you know, and things like they've fought bad breath, they've had loose teeth, maybe they've lost a few teeth. I've had people tell me that some of the craziest stories, you know, and how they've lost teeth. You know, one lady told me that she'd lost a tooth on her second honeymoon at a romantic interlude with her husband.
Wow.
So that's one of those things where you feel for those people, but they're the people that are either in denial because they really don't want to admit that they have the problem, or they are people that have been fighting the problem day after day, week after week, year after year, and trying to do everything they can to maintain their teeth.
But they're headed for dentures.
But they're headed for dentures. They're the people that will ultimately wind up in my office.
Now, are there that many people wearing like an upper lower denture? Like this, the reach of this program will be about 20 million people.
Right.
So would you say like a lot of denture wearers out there?
According to recent statistics, up to 30% of the population in this area and across the United States, there are roughly 30 to 40 million, depends on whose research you read, but there's roughly 30 to 40 million people that are wearing dentures. The most recent study I saw said there were 40 million people wearing dentures in the United States. In the age group from 65 to 74, 30%.
Okay. Now, if there's so many denture wearers, like you say, right? Let's say hundreds of thousands, why aren't they all doing this? Why aren't they coming in and just saying, you know, I want to secure my denture with dental implants?
Well, for a lot of them, I think it's the fear. I mean, that keeps them away. They think, oh my God, that's going to be really painful. It's going to be really time-consuming. It's going to be very, very expensive. I mean, those are some of the things that we always hear. It's, oh, it's too expensive, or, you know, it's too painful, all those things. And most people, the truth of the matter is, have almost no pain. Now, that's all variable, of course, from patient to patient, relative. But most people, when I ask them, you know, was it really painful? No, I took a couple pain pills. We manage that very well with anesthetics and
But during the procedure, they're not feeling anything?
During the procedure, most of the time, they're asleep.
Okay. Or they're sedated.
Or they're sedated, sorry.
Okay.
Sorry, they're sedated. So the number one reason that people don't have this done, you would think everyone would want to have it done. They just don't know their options. You know, again, remember when I said they were out of the loop. A denture wearer, typically they have their teeth removed, they have dentures put in, maybe they go back when they have a cracked tooth or something chips or breaks, or it falls out of their mouth and the dog eats it, you know, or something like that. But for the most part, they just don't come into the dental office, so they're therefore out of the system. So they don't know their options. They don't know all the great things that we can do today.
How old can you be to do this?
Well, that's the beautiful thing. The oldest patient I've been associated with that's had this done is 102.
Why would a 102-year-old want to do this?
Well, why wouldn't they? I mean, you know what she told us?
What?
That she didn't want to be a frowning, toothless old lady for her great-great-grandkids. And also, as we all get older, nutrition becomes more and more of a bigger part of our life because, you know, let's face it, food is a big part of families. You know, family get-togethers, food. And if you don't have teeth that you can eat with, then how can you enjoy and be yourself with that situation?
So you can eat whatever you want.
You can eat with whatever you want.
These teeth.
Whatever you want. Age is not a problem. I have plenty of patients in their 80s, 90s, even into their hundreds. And you would say, well, why are they doing that? And it's because they want to eat and chew. They want to look good for their grandkids, and they're going to a lot of their grandkids' weddings and family get-togethers, and they want to be able to just enjoy life.
Is it like a brand new set of teeth?
It is your third set of teeth, basically. You get the baby teeth, the adult teeth, and they come in, and this is like a third set of teeth. These are the teeth that now you can replace and live out the rest of your life with.
Now, is this true? I mean, in your office, somebody watching this, if they're wearing a denture, on the day of the final day of the procedure, maybe they've been there a couple visits, but on the day of the procedure, they can walk in with no teeth and walk out with a brand new set of teeth, upper or lower.
That's correct.
Does that happen?
That happens all the time. It happens every week, every day in our office.
All right. Now, you worked with one of the largest implant centers in the country, which has offices across the country.
Yes.
You're with them quite some time. So you have a lot of experience. I guess you've done a lot of these.
I've done a lot of those. I've seen a lot. I always say that there's, people come in and says, oh, doc, you wait. I've got a situation that you've never seen before. I said, no, we've always seen something worse. You should never have the fear that it's something that we can't take care of. And because I've always seen something different and worse.
What do they like the most? Of what they can eat or the way it looks?
I think it starts with health and eating, but I think they really respond to the compliments. They'll get compliments left and right, like, wow, you're looking good. Did you lose weight? You seem so much more outgoing. You'll see these people, one guy that I can recall had this done, he was wearing dentures. He could now scuba dive. Okay. You can't scuba dive with dentures, apparently. I didn't know that. Maybe you can, but he didn't think you could. So there's people that do all sorts of things. They skydive, they, jump out of a plane and you lose your dentures. Yeah. I think there's a Facebook thing like that, where people jump out and they lose their dentures. But with this, they're permanent teeth. They're just like your teeth.
Now you have photos.
Yes, I do.
So what'd you bring here?
Well, this gentleman came in and he was a local pastor in one of the largest churches in the area, and that wasn't what drove him in. What drove him in was he couldn't eat or drink anything that was beyond room temperature. He couldn't take anything that was cold, and he loved ice cream.
Okay.
The churches, you always have ice cream socials and things like that. But he just couldn't eat and chew, and he just didn't like his smile anymore. And he'd tried all sorts of things. He'd had crowns and bridges and partials and dentures, or partial dentures, and all sorts of different options. But he was just uncomfortable all the time. And like I said, he didn't like his smile. So this was, his options. He was heading for dentures, and he even asked me that. And he'd had several consultations. He says, should I just go and resort to dentures? And I said, no. I mean, you don't have to do that. We have a better option for you. So one day he comes in, and by the end of the day, he comes in early in the morning, and by the end of the day, he has brand new teeth, upper and lower teeth.
How soon could he eat?
Well, you can pretty much eat the next day after the numbness wears off. You have to modify your diet a little bit initially, for sure, until the implants kind of settle in. But for the most part, within a few weeks, you can eat and chew just about anything you want. So guys like this, he comes in, he wants to enjoy his family life, his social life, inside of his church with his parishioners and this sort of thing. And he can't chew and eat the things that they bring. And so his main thing was ice cream. Now, you think anybody can eat ice cream, but he couldn't enjoy ice cream because his teeth hurt.
It hurt.
It hurt. So with this, he's able to eat anything he wants.
Let's take a look at that after. Wow.
Pretty amazing. Yeah, he's got a dynamite-looking smile. And the thing about that is, what do you see, Randy, when you see the person in the before picture and the person in the after picture? What do you see?
Well, he looks healthier. He also looks a little bit younger.
Right.
Going into this, I always think, well, it's just teeth. And you said, Randy, it's more than teeth. No, but it does. It changes his appearance. Looks like more like a vibrant guy.
My favorite part to look at the eyes. Look at the difference in the eyes.
Oh, yeah.
The eyes are the eyes have it, right? But the eyes in every one of these patients that I do, I'm kind of amazed at the changes. I mean, I've been doing this for years, and I love doing it. It's you go in the office, and it's something to look forward to.
Okay.
And because I know what kind of results they're going to get. And just look at his eyes. That pretty much tells you everything you need to know. Because in the before picture, he can barely get his eyes open. That's a big smile for him. And now, look at his eyes. Their eyes are wide open. He's got a beautiful smile. He can eat and chew anything he wants. Here's this young lady.
All right.
Nancy. And this is one of my favorite stories, honestly, because she's probably one of my, become one of my favorite patients, and I'll tell you why in a minute.
All right.
She came in, you see the picture on the right. She had tons of problems. She had bad breath, she had decay, these are all things she was complaining about. Her smile, she just was embarrassed by her smile. And you can see that, she's just somebody that looks like they're in a lot of pain.
You say they don't even want to smile on these before photos.
You
have to ask them to smile.
That is a big smile for her.
Okay.
I mean, that was really pushing it. And you can see, again, even in her eyes, you can see that she just doesn't feel good about herself, and she just doesn't feel good about her smile.
So you couldn't save those teeth?
I could not save those teeth. She'd had a lot of different procedures many years before, but I can't remember exactly off the top of my head, but I think it'd been a number of years since she was in. And for a lot of these kinds of patients they are fearful of going to the dentist, this is like a whole new world, because she came in and she could have this done in a day. So we gave her our options, and at the beginning she just wanted to have dentures. That's what she wanted. She wanted to have dentures, and I said, okay, we'll do dentures. So we did an upper denture, immediate denture, where we took out the teeth, put the teeth in same day. She did really well. Came back in, then the next week we did the lower teeth, did the lower denture. We were going to put in a couple implants, but it just wasn't, the conditions weren't right, so we had to put that off. She was miserable with these dentures, like most people with dentures. Okay. She just hated them. She couldn't taste food the same way because there was that palate that was covering the top of the roof of her mouth. Then we went in and put 2 implants in the lower overdenture. It fixes
like a snap in,
like
snap
a
out
snap out.
Okay.
And I'm not a big fan of those, to be honest, because there's always something out of adjustment. You have to constantly change things. I've done them. I've done lots of them over the years, and they're better than no snaps at all, but they're only a little bit better because they're still a denture. There's still things get up underneath them. You have to clean them after you eat, or else it's uncomfortable. So we did that. And I kept working on her, and as she'd come in, because she would just said, "Oh, this is just not comfortable. I just can't eat and chew." So finally, she said, "Okay, Dr. Wolf, you're right. Let's do the lower, with the implants. Let's do
like teeth that don't come out.
Teeth that don't come out. I just want to screw them in and be done with it."
Okay.
So we did that, and all of a sudden, her whole world changes. She's like, "Wow, this is great." Within a short period of time, we did the upper. And the funny thing I haven't told you is, she actually, during that period of time, from the time that you see that person on your left to the time that you see that person on the right, during that time, she began working in our dental office at the front desk.
Nice.
So now, and you ask yourself, how would a person like the one on the left feel about working in a dental office where teeth are a big deal?
Yeah. Good point.
So she's a phenomenal individual, and that's the reason I said she's become one of my favorite patients, because I see her all the time. I've worked with her very closely. She's a smart, intelligent, attractive person who she's very charismatic. And when people come in to the office and they want to know, hey, how is it really, with these dentures and these implants? She can tell them firsthand because she's had it all done. Not just.
But it looks very nice. I mean, that after, and she looks different.
Oh, it looks like she might be related to the person on the left, but they don't look like the same person. Randy, when they see themselves in the mirror for the first time, I mean, it's kind of amazing, because I've had, plenty of women cry, assistants cry, I've cried. A lot of men, you wouldn't be,
they're fighting back
the tears because it's such a change, and there's a lot of emotion and pain for a lot of these people. Not so much, not even necessarily physical, but a lot of times it's just emotional pain of what they haven't been able to enjoy for years. Over the years, I've heard people tell me stories that some of which I was a little bit over the information line, but a lot of people have told me, I haven't kissed my spouse in 20 years. My spouse told me my breath was offensive. It was just they didn't want to kiss me because my breath was so bad. Or my teeth were loose, and I was afraid to go out in public because I was afraid that by just eating and chewing normally, I was going to lose my teeth. So there's been the mirror, when handing the mirror to these patients for the first time is always one of my most exciting times, because you just see this warmth go over there. And like I said, look at her eyes. We talked about the eyes of another of these other patients. Look at her eyes. Her eyes don't look anything like they did on the left.
This looks,
They're open. and they're bright, and they're warm, and they're showing you that there's a real person behind there. Here's another young man.
All right.
Came in. He'd been involved in an accident, and and he'd lost some teeth, but he also just had kind of given up. He told me, he says, I just kind of given up. My teeth and my mouth is such a mess. I know you've never seen anything as bad as I've got. And of course, as I said before, there's very little that people can bring in that I haven't seen.
But that before does look unusual. I mean, that's got to be unusual to see something like that.
And you don't see it so much because he just doesn't smile. He just doesn't show it. And look at his picture, his after picture on the left. He's now smiling.
Yeah,
he's
nice.
happy. He's happy. He's confident. And all of a sudden, he can go from, hiding his smile and being the master of the cover-up to showing, his true personality. A very outgoing guy, and this has helped him to totally get a new lease on life. So with him, he comes in the morning of the procedure. We lightly sedate him. Remove the teeth, place the implants, put the teeth in, and out he goes. So by that afternoon, he has a brand new smile.
Is this one of those things where they say, I should have done this a long time ago?
Pretty much that's one of the most common things I hear is, I should have done this years ago. Because it's the fear of what they didn't know, the fear of the unknown, the fear of, there's going to be painful, this is going to take so much time, it's going to take appointment after appointment. But because we do it all in one location, we can do this all in one day.
Yeah, but isn't it true? I mean, if you've been wearing dentures for like 20 years, you don't have enough bone to do this.
That's not true.
Okay.
And in fact, a lot of people come in with that question and say, oh, I've been told many times that I just don't have enough bone for this. And that's usually experience. The experience of the dentist being able to place the implants in such a way or use the technology, because there's all sorts of great technology now that allows us to get away from sinus lift and grafting in many cases, and bone grafting, and able to use these special kinds of techniques and implants that allow us to do just about any procedure that will present to us. Okay, here's another lady. You can see her daughter was getting married, and she didn't have a lot of time to come up with a solution because she knew that she wanted to look better for her daughter's wedding. Who doesn't, right?
Yeah.
Your child's getting married, you want to look your best. And so she came in and she had an upper denture and just a couple of teeth on the lower. That was it. Now look at that before photo. That's her smiling. And we have that happen all the time where people come in and they just won't smile. And again, look at her eyes. I mean, she just doesn't seem real happy.
She looks like a very serious person.
She looks very serious. And she's completely the opposite.
Okay.
She's completely the opposite. And as you see in her after,
wow,
in just one day, she went from the lady on the left to the lady on the right. It totally changed her appearance. So look at the lady on the left. She looks much younger. She's more. Look at her eyes again.
On the after photo, she does look younger. Yes,
she looks much younger, and her smile. She is very outgoing. She's very friendly. She's very affable. And the person on the left, you wouldn't think that. You wouldn't think that, but she's just a super person.
She looks like a different person, by the way. I think anybody at home could agree with this.
Yeah, I mean, she does look like, she's related to the person on the left, but doesn't look like the same person.
Yeah.
So I see this all the time, though. People come in, they look like the person on the left.
And they don't want dentures. I mean, did they tell you that? Like, look, doc, I don't want dentures. I don't want teeth to come out.
They knew they wanted something better.
Okay.
And we knew that we had something better, and that's why she came to us. Here's another patient, Charles. He, a gentleman that's in his 80s, and his main complaint, he'd lose his denture. Or he had an upper partial. He only had 3 remaining teeth. He'd lose his partial while playing tennis. Okay. He was competitive in tennis, very competitive, and he just couldn't stand the fact that when he was going for a shot, that his teeth might slip. And you and I don't think about that because we have our natural teeth, but. So that was what drove him in. He just knew that an upper denture was not going to work for him, and so that's what brought him into the office, just to have this done in a day. So he comes in, he comes in the morning. He's lightly sedated, teeth are removed, remaining teeth, implants placed, teeth placed, out he goes. And a lot of people ask me about pain. And one of my favorite stories about this gentleman was he called me. I called him the next day to check on him, like I normally do, and he says, well, I only have one question. I said, well, what's that? He says, am I okay to play tennis this Sunday? And I said, well, this was, only a couple days away. And I said, well, if you're feeling up to it, fine. And so he did. He comes in the office the next time, and I said, well, tell me, did you win? And he says, yeah, I did. So, and this guy can eat whatever he wants. He travels, he and his wife travel all over. And he loves the fact that he doesn't have to worry about having a denture that he has to take care of.
Okay, good. Time for a couple more photos.
Here's another patient. I mean, you'll see, this lady's very attractive, young. Her teeth have just, she's been fighting it. Bacterial infections. She complained of bad breath. She complained of loose teeth. All those problems. And you might even draw, a wrongful opinion about somebody like that. You might think, oh, just isn't keeping herself clean, because she isn't able to brush and floss like she should. And the truth of the matter is, she probably brushed and flossed and everything else
more than most people.
And the other side of the coin is, if you saw her, she's meticulous. I mean, her dress was meticulous. The way she presented herself was always meticulous. The only thing that was standing in her way was her teeth. So she heard about us. She knew that she was way too young for dentures.
So she was headed for a denture.
She was, absolutely, she was headed. Some of her teeth were almost falling out.
Okay.
So she was headed for a denture. Now you see the person on the left, or on the right, excuse me. You see the person on the right. I mean, now she can. And
looks like the daughter of the person on the before photo. I mean, it really does.
And the funny thing is, she was in the office not too long ago, and it was funny because I saw somebody standing out the window, and I said, "Who is that?" And it was her. And I really didn't even recognize her because she looked so different. She looked so much more youthful. And I think that's one of the other things that people often forget, that when you have these kind of procedures done, you can look so much more youthful, look more confident. And again, look at the eyes and her smile. I mean, everything changes. Her whole face changes. Randy, people with bad teeth are often judged, rightfully or wrongfully, but they're often judged. I mean, in Hollywood, on the movie sets, what happens? If you want to make somebody look like a villain, what do? You darken out, gray out his teeth. You make him look dark and ugly. Okay. Or you may want to make some person look not so intelligent. What do? Remove teeth right in the front of their mouth.
That's a good point.
All these kinds of things. And the people
like the poor people in a movie, they want to give them bad teeth.
Yeah, they're trying to show that they're homeless or something like that. And it's basically a kind of a misnomer, because the people I deal with, all these people I'm dealing with, are not those kind of people. They're not. They're all, many of them, executives, or housewives, or teachers, or you name it, up and coming professionals in the community. So it's one of those things where they're wrongfully judged because of their smile, or maybe they think, well, that person is a lot older, or they aren't very happy, and all these things are important because with a brand new smile, they have the confidence, and all you have to do is look at these before and afters over and over and over. You see the eyes and their smiles, and it's their confidence that radiates completely through them and allows them to show through.
Now we have to mention, I mean, Medicare, Medicaid does not cover dental implants. Even the best dental insurance doesn't cover the whole thing.
Randy, third-party financing is where a lot of this gets done, and we offer several options for that. And you have to have decent credit, but for the most part, when people make up their mind and they know how simple this can be and how much this can change their life, they figure it out. And that's what we're there to do. We have people, in our office designated to try to help them figure that out, because it's so important to them.
So no more dentures.
No more dentures.
Could you wipe it out in Orange County and LA?
One mouth at a time.
Now we're short on time, so I'll let you pick one more.
This gentleman here, he, great-looking guy. His teeth had kind of started to fail.
Do they tell you, like, I hate my teeth, or I hate my smile?
Yes. A lot of people do. A lot of people come in and they say, I hate the way I smile. And that's the reason they don't smile. I mean, even this guy, he was a real jokester. I mean, this guy is a consummate jokester, always cracking it up. And he, even after you got him going and you got to know him, you realize how funny this guy really is. But, he was just always, ribbing somebody, or, he was the life of the party, kind of the jokester. And you can see, again, a guy like that who's got a great sense of humor and always trying to make everybody feel better around him, he doesn't feel very good about himself, because you look at how he barely can get him to smile. That's a big smile for him. He says, I never take pictures. Okay, look at him on the left. Again, look at his eyes. Look at his eyes. So much different, and his face looks different.
You told me going into this that people look younger, and I'm skeptical.
Yeah.
You know, it's like, okay, but this guy looks like a different guy again.
He looks so much younger.
Looks like he heads up a big company or something.
Yeah, I mean, and that's it's the confidence. It's the teeth. The facial structure changes because the muscles that support the face. Oftentimes, if you're not smiling, you know, they're not being stimulated by much. And if you have bad teeth and loose teeth or missing teeth, you know, that muscle, it's just like if you don't work out your muscles, they get a little flabby, right? Well, so the same thing with your face. Those muscles get a little flabby. You start exercising them with permanent teeth, everything changes.
So this guy, on the before, dentures are one option. But there's no way they're going to get dentures at your place these days.
No, I mean,
his options were a brand new set of teeth supported by dental implants.
He came to me because he heard that that's what we did.
Okay.
And he knew that that dentures was what he'd been pitched on several occasions, and he knew that that was not what he wanted. And so, I mean, I still do some dentures from time to time, and I tell him, look, nobody's ever happy with dentures. The lab's never happy. I'm never happy. You're never happy. The assistants are never happy. No one's ever happy with dentures because there's always something going on with the dentures.
But I know denture wearers. They never complain.
Maybe not to you, but you know, one of my favorite stories.
Okay.
One of my favorite stories is, you know, for years, you know, I go into a dental operatory and to see a denture patient, and they say, "Hey, doc, I want you to take a look at these dentures." And I start to look in the mouth, and I said, "Well, where are they?" And they'd reach into their pocket or their purse, or you know, their shirt pocket or something like that, because they were carrying them around. And I'll never forget this one lady. She told me, she says, "Oh, I take my dentures out to eat." I said, "Look, I'm just a kind of an Iowa farm boy, so you're gonna have to dumb it down for me a little bit on this because I thought the teeth were made for chewing and eating." She says, "No," she says, "it's too big of a hassle. I can't eat with the teeth in. I always take them out to eat." So that's one of the things that I felt like was my goal, was to get rid of that kind of concept, because it makes no sense for people to not have a healthy smile that they can eat and chew and live life and be pretty much, you know, carefree.
Now we're out of time. Final message. Somebody watching this, maybe they're currently wearing a denture or they're headed to a denture. But for whatever reason, maybe they heard what you said, but they're afraid. What do you say to them?
Just come in. You know, we offer a free consultation, 3D CAT scan, and most people are you know, kicking themselves because they realize they could have done this years ago, and how comfortable it can be.
Okay, good. I want to thank you for coming to the show.
Thanks so much.
Great pleasure. And now they could go to your website. I mean, you got a lot of photos on your website.
Yes,
I mean, we could only jam in a few of these, but I mean, you have helped a lot of people.
Right. So there's plenty of, you know, of photos and before and afters and testimonials on our website. You can check it out there.
All right. Thanks again for coming.
Thank you so much.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.